Hey everybody, we'll wait just another minute or two to make sure folks can get in, and then we'll get started. This is Will Brown. I'm the professor and director of the Center for Nonprofits and Philanthropy, and Angela Seaworth is here with me. Yeah, give us just another minute and we'll get going. You'll see that there is the chat box. You can use that as a way to chat with each other and talk, as well as share, ask questions. We're probably going to get up. We're going to get up in pretty good number, so it may be a little tricky to have you talk questions. We'll see how it goes as we get moving along. But use the chat box, and Nicole and I will be tracking that to try and be able to filter those a little bit, but also be able to facilitate a conversation with Angela, because I think the intent here is that she'll talk for 20 to 30 minutes or so. We will, if we haven't made the slides available already, we'll be able to make that available for you so that we can get that accessible. We'll either email it out to you or it'll be posted on our website. Also wanted to just mention, so what are we at, 12:01? Well, we're excited to be able to offer a series of workshops here as we're in a kind of a tumultuous environment here of really trying to understand what our role will be, how we're going to be able to serve our clients and our constituents that are important for us, thinking about how we keep our staff, how we keep people connected to our organization, engage our board members, and all that's entailed associated with keeping our organizations afloat. So we put together a series of 4 webinars here that'll go through the next month. Of course, this week is right off the bat to try and get a handle on the policy and sort of legal environment in some sense, but also to really be able to emphasize the management implications. Dr. Seaworth has done quite a bit of work to try and be able to get our hands on some of this stuff. It's an evolving and shifting context. She'll touch on that as well. Next week is leadership issues with our own Kenny Taylor, and then I'll take the third week and talk about boards and think about how boards work. And then the fourth week we'll come back to Angela to think a little bit about fundraising and some strategies. And I know she'll touch on that, and that'll probably get touched on by several of us. That stuff's listed on the center's website, so feel free to go there and register. We do appreciate it if you can register beforehand and join us. But same time each week, and we're thrilled to be able to have you here with us this afternoon. So I think I got the questions in the chat box. We'll be monitoring that. So yeah, let's go on ahead and get started. There's no sense in me rambling on. Did I miss anything, Angela or Kenny?
I think we're good to go.
Okie doke. So Angela got a PhD, Philanthropic Studies, from Indiana University's Lilly Family School of Philanthropy. So that's kind of a distinctive PhD degree program. She's probably one of the first early graduating class there with her PhD program. She was also the founding director of the Center for Philanthropy and Nonprofit Leadership at Rice University. So we're thrilled to be able to have her here as a part of the Bush School at Texas A&M. She teaches for us the Management and Leadership course, the foundations of the nonprofit sector, and fundraising in nonprofit organizations. More than 20 years of experience in the nonprofit sector as a professional, working for places like the University of Chicago, University of Houston, and a chief development officer at 2 independent high schools. She's also an advanced certified executive fundraising professional and a certified fundraising professional with the AFP chapter. So Angela, it's a thrill. We're honored to be able to have you here as a part of what we're doing and have us a part of our team here at the center. And I know folks are anxious to have you get started. So I'm going to turn it over to you.
Wonderful. Thank you so much, Will. I appreciate it. I love working with you guys at the center, and the students and the faculty and staff there are just fantastic. So it's a real delight. And thank all of you so much for joining us today. I know that we're all navigating a lot of different things, and for you to take your time today, we hope to give you some really valuable and practical information to help you out with your nonprofits. But we do first and foremost hope that all of you and your organizations, your colleagues, your families are doing as well as we can be during this time. There's one thing that after 20 years of working in the nonprofit sector, I would say if we're going to go through some sort of unprecedented crisis, there's no group of people I would rather go through it with than nonprofit professionals and the people who serve the public. The work that all of you are doing is so critical, and we're going to talk a little bit about that today, and then how we can make sure that we keep our nonprofits operating, but also how we can take care of our employees. So I'm going to go ahead and share my screen. Just a quick warning, these are text-heavy slides, but the reason I'm doing it is so you can have a resource and you won't have to worry about taking those notes. We will go ahead and get this to you in PDF format afterward or post it online, like Dr. Brown said. 1 second and we'll get started. Can everyone see? Got a thumbs up? Okay, great. So you see, today we're really focusing on the finance and HR policies, but we're not going to be able to go into extreme detail for those because each of the briefings for like each section of the policy is a couple pages in itself. There's no way we could do it in just 25 minutes, so we have time for questions. But my goal is to be able to talk about it and then for us to really focus on the management implications. And then you'll have this to be able to go back to your shops and work with your, the appropriate people to actually implement it. The main mission idea that I'd really like us to frame our discussion around today is the fact if your mission was important a month ago, it still is. So, it's on a slide by itself for a reason. When we're nervous and about how we can move forward and we're dealing with so much, we have to remember the value that our organizations really bring to our communities. One thing, just wanted to let you, as a reminder that this information is really just educational. We want to make sure that you have information that you can go back and work with your own accountant and attorney for any questions regarding legal compliance or financial compliance. We've dug into this from a nonprofit management perspective, but we're not the law school. I'm not an attorney. So we just like to remind you. The other thing is within our sector, I think we wear it with a bit of pride, is this label that if you've seen one nonprofit, you've seen one nonprofit. So we're not going to have a one size fits all, but we will be able to give you some really good basics to think about. So right now, we're all trying to maintain our operations. So some steps to sustainability is what came to mind first. Sustainability almost seems like a luxury at this point, but we hope to be there by third, fourth quarter. So we'd like to encourage you to start by assessing your situation. And part of that is including your board early on. And in one of our later seminars, actually both Dr. Brown and Dr. Taylor will talk about board and leadership. But we need to make sure and engage them early on in the conversations. Don't wait until you try and run 7 scenarios and you're stuck before you go to your board. Bring that in for HR and finance planning. Make sure you're going to evaluate your situation financially and be really honest with yourself about your demand that you're going to have for your services. We have to be honest about where we live in the ecosystem in our nonprofit community. To see if we're a frontline provider, and we've talked with a lot of organizations over the last couple of weeks, and if you're one of those frontline providers, you're probably working more than you ever have right now, right? But there are other nonprofits that maybe we're a second or third tier type of service at this point in our public health emergency. So be really honest about that, because that's going to help you come up with better scenarios for what you're going to need with staffing and in finance. We're going to encourage you to take advantage of any emergency relief that's out there, and we're going to talk through the 2 main ones. Though, as Dr. Brown mentioned, this has been changing, and as of yesterday afternoon, I was sort of polishing this up and realized that I just got a note that said 90% of the first round of this funding has been expended. But the good news is Congress is supposedly moving forward. They want to replenish the PPP and potentially the EIDL. So we're still going to talk about that in case you've not filed. And then the last piece, with these maintaining our operations now, we have to continue to generate revenue. So some people are afraid to do fundraising in this environment, and it's something that we absolutely must continue to do. Right now, we want you to be communicating with your constituents, almost over communicating with them. But you are going to have to pivot your story and to speak about what you need now. So these are the things that are top of our mind. And of course, also within this is managing our staff and taking care of them. So moving into our sources of revenue, I thought this was just a quick way for us to think about the reality we're going to live with in 2020. You'll see most of our revenue streams are probably going to go down. But there are some areas where we think that we could potentially count on, okay, as far as thinking about finances. One, donor advised funds, we would anticipate more gifts coming from those. Those are restricted. The only thing the donors can do is give that money away. And what we know about generosity, and particularly during times of crisis, we'll see donors give more. So hopefully people that have been saving those DAFs and building them up will want to go ahead and give more this year. Foundation will expect to see more giving from them simply because of this response to this emergency. And we'll talk a little bit about how they might change in their giving. We're going to see tremendous generosity, and we've seen that in every crisis when we study philanthropy. We see that overall, but individual giving itself, even though we may be giving in different ways, that's going to demonstrate the generosity, the actual number of gifts from individuals, we should probably expect those to decrease. The other piece I wanted to note is with the government funding that many of our nonprofits rely on. Most state budgets are going to have to receive potentially a government block grant to try and even make their own budgets this year. So within that, I was talking with some colleagues here at the Bush School that specialize in the government funding, and what they're suggesting or predicting anyway is that any of you that have contracts with the government to carry out services, it's a good chance those contracts will be fulfilled. They might be slightly reduced, but they would expect or anticipate those will still remain in some way as a revenue stream for you. If you're getting grants through the government, you should probably expect those to be gone. And then the last thing is we don't talk about a lot in nonprofits is really making smart use of our lines of credit for short term. So those are the areas where I see at least 3 or 4 of those that we could count on as dependable revenue moving forward. And we're going to go ahead and dig into this. Again, we're not going to spend a lot of time, but I wanted you to know the difference between the 2 different emergency loan programs. See, they're both for 500 or fewer employees, but the PPP is really to try and retain employees. That's the entire motivation and incentive behind it. So 75% of that loan is going to have to be spent on payroll costs. And you'll see on the slide, there are quite a few things that actually qualify there. So it's not just salary, but it's also if you rehire someone, if you lay them off immediately and now have access to the PPP loan, then you could rehire them, and this is part of it. Then health, their retirement benefits, also these employment taxes, that is all part of the 75% that you'll need to use. Additionally, you can use this money for, as you see, mortgages or rent, utilities, things like that. So this is going to be fully forgiven up to that 75%, or as long as the 75% of the loan is used for payroll. I want to clarify that. If for some reason you don't meet the threshold, so some of your loan is not forgiven, then you'll have 2 years to repay it, and you can even defer that for a year, and the interest is going to be locked in at 1%. So that should be really reassuring. We know that these loan processes haven't been perfect by any means. Our banks were overwhelmed, but from the nonprofits I've talked with in the last 4 or 5 days, quite a few of them are starting to hear back. So that's something hopeful that I'd like to share with you. On the other hand, the EIDL loan, this can be is the loan where you hear there's a $10,000 advance grant. That's really up to $10,000. And also keep in mind, if you apply for that, and we recommend definitely check the box at the end of the application to get that $10,000 advance grant, that it will be deducted from the amount you receive on the PPP, okay? Within this, the grant itself, when you receive that, it is forgiven, but the EIDL is a loan. So you can receive the $10,000 advance grant without actually applying for the loan. So that's why we say it's definitely worth going through the process. We're hearing that people are not getting their grants within 3 days, which was the goal originally, but they are hearing about starting to hear back. And this could be repaid for up to 30 years. And again, a low interest rate is locked in. Wanted to give you a couple slides just so you can understand. One, if you haven't looked into it, here's the link from the Small Business Administration. I know that it's going to take about 2 hours to apply for this one, but there's no collateral. There might be some confusing language though, so wanted you to know that if it talks about owner, remember both of these loan programs were designed for not only nonprofits, but for small businesses. So anytime it says owner, we should be thinking about as the executive director or the CEO of the organization, okay? And then with the details about the PPP loan are here, the application link. If you aren't, I'm sure about a lender, there is a link to find a lender within your area. Just type in your zip code. What we're finding is that there are more small banks, okay? Some of our larger banks have been overwhelmed, but some of the smaller lenders or lenders in smaller communities have been able to process this and manage it a little easier. So if you're in a smaller community, that's one of the benefits right now. This is definitely going to take more information to pull together, because you have to be able to develop your and estimate your average salary over the prior 12 months. But the loan through the payroll paycheck protection program can be up to 10 million. So what it is, it's the lesser of 2.5 times that average salary for the prior 12 months, or 10 million. The one thing to note within this is that you definitely have to, you can only use up to $100,000 of your employee's salary to calculate that average salary. So if somebody's making, you refer to a small school, for example, and maybe you have a principal that makes 120,000, you'd have to shave the 20,000 off and only report 100. So similarly to executive director salary or potentially fundraisers. And this, I don't mean to confuse you with all these lines. We'll talk through it quickly, but it's an example of how your organization can think about utilizing these two loans. What we want to do, looking at the very top graph, the blue line, that's fine before anything about COVID. And then the red line, what we've done is try and use financial scenarios and figure out what your worst case scenario is going to be. And then what we want to do is try and use these loan programs to close the gap. Okay? The second loan line here is explaining when we think you should probably start using those. Like immediately try and use the EID grant. So, because that's what you'll get first. Then move into the PPP loan, and then use that, because you need to use that in the 8 weeks after you apply, and it can extend longer. But then what you would wait for is actually for your EID loan to be processed, and then you could use that throughout the rest of the year. And that loan, again, can be a lot larger, and it can cover more than payroll. So we really encourage you to think about using that third quarter and out, because we're expecting a lot of nonprofits to struggle in third quarter. And I've talked with some folks that say they don't want to apply because they're not sure they're going to need it. So we really encourage that you do step forward and apply now, because if you don't use the EIDL, you can repay it with no penalty. So we'd rather you try and have it and have that security for your nonprofit so we can keep serving our constituents. But that's what the last line is showing, is really in the executive actions that we think you should take, and have the EID. And if you're one of the lucky organizations that can pay it back early, that's terrific. So the other emergency funding opportunities are going to be really through our private funders. And what we're hoping to do is figure out how they're going to step up and actually help our communities as well. So I've listed some of the local ones here in Texas and some of our larger ones, but many private funders aren't responding in an emergency. They may do one quick loan up front, but then afterward, what's happening is we're counting on these sort of local community initiatives to start filling in that secondary gap while our private funders are taking time to really develop their own strategic response. What they're doing is they're holding back a little bit to say, we're not sure where this is going or how long it's going to last, so we want to come in sort of as that third wave of philanthropy. An example of this is a couple days ago, the Ford Foundation launched a fund with 6 other funders, and they hope to get that up to 20 million. But their goal is really to try and help anybody. It's almost a safety net for people who are being hit by this the most. So they're looking for workers and families and anyone, communities who are most devastated. This loan is not, or the applications for this grant, sorry, it's not open yet, but I wanted you to have all the links. They should be figuring out how they're going to disseminate that quickly. But they're trying this through 2 separate approaches. One, there's going to be direct relief to individuals. And those are folks who are specifically dealing with layoffs and business shutdowns and have caretaking duties that that prevent them from working. The other is working on trying to center vulnerable populations. And you'll notice I've highlighted here, this is where community nonprofits will be available to apply for funding. So overall, with the financial piece, this is what we're looking at. We encourage you to immediately apply for those emergency assistance loans and then just move through the flow chart. Make sure you're doing financial scenario planning to find out where you are. Look at how you can smartly use your reserves and intertwine that with any of the emergency assistance. Talk to your banks about short-term loans to fill in between like the second, third quarter. This is now when you can start really being thoughtful about a fundraising initiative. We needed to let people absorb the shock, but now's time we can be thoughtful and really develop a strategy for how we can do professional fundraising to help us. And as you notice, the very last thing that we recommend is consider touching your endowment. Those are so hard to raise. If there's ever been a time, certainly in my lifetime, but even the last 100 years, to use the endowment, it might be now. But we do still recommend that you try all these other options first. If we're dealing with fundraising right now, as I mentioned, this is the time to really pick up the phone and talk to your most loyal donors, over-communicate with them now. Even if the message is we're adjusting, we're figuring out which of our services we can provide, which ones we could perhaps provide remotely. We're figuring out our demand. So make sure that you're informing them, but also when you start talking about fundraising, we want you to frame your fundraising case. You're going to pivot from whatever you were fundraising for to what you specifically need now in order to maintain your operations and serve your clients. So the important thing to remember from an executive standpoint is we're framing the situation as our organization needs things. Like, I need money to keep my employees here or to serve our folks. But that's not what inspires donors. So what we encourage you to do is really to be thoughtful about the language you use. Rely on your development team for that language, because people are really inspired and persuaded to give because people have needs, right? They give because of the services, not because your organization has needs. So the folks who are closest to you, certainly your board members, your top donors, the most loyal ones who have given 5 years in a row, those are people that you can talk with a little more intimately about your organization needs. But we encourage you during this time to make sure you're still using your social media, getting any good service stories out there that you can, considering digital fundraising. We're not going to talk any more about it than this slide because we have a whole session about that coming up in May. But we also encourage you to, when you're surrounded potentially by board members who aren't comfortable fundraising right now, remind them you're going to be sensitive to what's happening, but your organization has to be out there telling its message, because if you're not, what we find from studying fundraising over time is it's going to take you much longer to recover. Okay. So with that, I'd like to switch from really talking about our external constituents to serving our internal constituents and some of our human resources goals and the policies around that. One of the challenges that we've got, I think, in nonprofits is we have to manage a mixed labor force, right? Most of us are using some combination of paid staff and volunteers, and we've got a volunteer governance structure. So that's unique to what we do. And I think one of our goals is we want to try and blend anything we know from economic theory, organizational theory. We have to try and combine that. So we create an environment that attracts really talented people to come in and work and serve the public. And typically without the same compensation and sort of benefits and incentives that our corporate partners have. So right now, if we can kind of frame what our goals are around human resources and our challenges, I think it can help us figure out how to apply the policies as well as we can. We know it's really hard to find and retain good employees in the nonprofit sector, so we should probably be thinking about retention maybe more than other sectors are. We want to make sure that when we're using policies that we try and not only use them for accountability, but also use them to reward and, again, as an incentive to motivate and retain people who want to give themselves to our mission. But above everything, we have to make sure that we're really creating fair and equitable policies. One of the most concerning things I've heard in the last couple weeks is some nonprofits have come to me and just said, we didn't really have HR policies. So if you didn't have them, don't panic, but now's the time you definitely need help to write them. So we're going to go ahead and dive into a couple of the very basic things. The policy around this crisis is so detailed. There's a tremendous amount of employment law. So here are some of the things that we're going to be thinking about. All the emergency leave acts, equity among our workforce, and that's not considering fairness. What we're thinking about with equity is which of our employees have the resources they need, and how can we give them the resources they need to continue working remotely. That's one of the big challenges there. How are we using current benefits with the new leave acts? Also, we're thinking about expanded unemployment, and that impacts us as far as retaining employees as well. But yeah, there are multiple pages of briefings on all of these, but hopefully this is going to give you enough of an understanding to go back and figure out the right questions to ask about your organization, and then to engage your attorneys and your HR professionals to help you make the best decisions you can for your organization. Again, these next few slides are very text heavy. It's for your reference, so we're just going to hit them very quickly. The extended FMLA, that's 12 weeks of leave, but the employer doesn't have to pay for the first 2 weeks. Employees can use any vacation that they have instead during those 2 weeks, the first two. The pay will go up to no more than $200 a day in this, and it's up to 2/3 of the wages is what needs to be provided. The reason that this is a little different, this is when we're actually taking care of someone else who has experiences with COVID. The one thing, if you're a small organization, employers with 25 or fewer employees, you do not have to return their jobs and restore them to their jobs after this time period. That is a very different exemption, because typically that's part of FMLA, is that you come back and you actually find a comparable job for the employee, but there's some exemption for that. And also, if you have fewer than 50 employees, check with your attorney about the exemptions you have in extending this for such a long period of time, because if it jeopardizes your operations and the ability to keep functioning, there are exemptions around that. The Paid Sick Leave Act is different in the sense that that's giving 2 weeks of full paid on top of any other existing paid leave programs you already have. Okay, so if you're already giving somebody 1 day a month sick leave, then you have to provide an additional 2 weeks on top of that. The main, one of the main ethical points to mention here is that employers are prohibited from retaliating against any employee who actually wants to take advantage of all of these benefits for sick leave. And this is an area where we're really trying to protect employees within this policy. But there are 6 different criteria for eligibility. You can read through those, but there are different rates of pay. The first 3 criteria, you have to pay the employee full wage, but not more than $511 a day. The 4, 5, and 6, those bottom criteria, That's when they're caring for an individual. So it's the same as the other act where it's 2/3 wages not to exceed $200. So moving into healthcare, as you can imagine, healthcare and benefits, there's tremendous amount of information around this, but part of it is that your employees, and you should be able to also share this information just from an HR education perspective with your employees. But COVID-19 testing is to be paid by private insurance. The healthcare provisions in the CARES Act, it broadens the use, HSAs, so the healthcare accounts, and FSAs, they're capable of paying for much more than they used to. All sorts of medical products that used to be ineligible for reimbursement now are. So that's going to help families. Another thing is under benefits that you may have to, if you've laid someone off, you may have to provide access to paid FMLA if you rehire them. Okay. Another thing for us to be thinking about around healthcare and benefits is COBRA. And that's very complex, but you may have to provide COBRA, or you may find ways to extend COBRA if you're laying off employees with the intent to bring them back. Okay. Some of the basics about the unemployment assistance. This is a brand new program. So people who traditionally aren't eligible to receive unemployment insurance are eligible to get it. The first week of unemployment insurance is waived. Typically there's a waiting week, so that is waived. But this new pandemic assistance program is an additional $600 a week on top of what your employees would have traditionally received. So the third part of it is it extends the amount of time that they're able to receive funding and more than doubles it. And so a thing to note from a retention perspective is some of your employees actually might be making more money on unemployment than what they were making working for you. So think about that and how you use this and encourage them to take care of their families as you're trying to develop strategies. And you'll note that I do have the sources listed at the bottom of all these slides, which you'll have, so you'll be able to go in and directly to the Society of Human Resources Management and get all of the briefings and details if that would help your legal counsel that you work with. With retirement, this is really to help any of your employees who potentially, or clients you serve. If they have retirement, then they can make withdrawals and have the 10% early withdrawals waived. And this is if they're laid off, if they can't work because of childcare. So these are some alternatives that you could suggest to employees. The other thing is that if you're going to, when you do withdraw, there's a tax you have to pay on it, but you have a couple of years, actually 3-year period to pay back that. And also if somebody has retirement that they can take a loan against, they've doubled the amount, the loan limits. So those are different ways that you could try and provide some sort of guidance and support for employees that you're having to either furlough or lay off. And the last piece are the business provisions. We all have to pay Social Security tax for our employees, but what we're allowed to do now is to defer those payments to the government. So we can defer them and they have to be paid over the next 2 years. So all of your Social Security taxes, 50% of it's not going to be due until 2021. So till the end of the year, December 31st on 2021, the remainder is then the next year at 2022. So that's going to be a big help for organizations, particularly that are a little larger, mid-sized, that have significant Social Security tax. The other is that there's a refundable payroll tax credit for wages paid during the COVID-19 crisis. So that's something to look into. And now we get into sort of we're going to wrap up with the management implications around this. If we have to find ourselves in a situation where we have to lay off employees or reorganize, what do we do? So in order to be perceived as making fair decisions, there are a couple different methods for that. Most of us are familiar with last in, first out. So if you were the last one hired, sorry, you're the first to go. But there's also skill-based, and that's if you're reorganizing and perhaps combine some positions. If it comes down to that, you've combined a position and you're having to choose between two employees, then the one that is most suited and has the skills for that position is the one that you would be able to justify keeping. The third method is performance-based, and this is something I really want us to think carefully about, because we can retain talent with this method as opposed to last in, first out. Maybe the last person you hired was your strongest employee, but they have to go if you're using that method. So if you're really looking to retain your top talent, then you would use a performance-based metric to decide who you're going to furlough or let go. But the reality is you have to make sure that you have documented performance reviews around that. Otherwise, then you open yourself up for risk as to why they were selected for dismissal. And that's something your if you're large enough to have a human resources person with you on staff, they'll be able to certainly help with that. If not, then we suggest that you seek some counsel and making sure that you're doing this in a way that doesn't open the organization for more risk. So when we're thinking about, right now we're not faced with a lot of good options, and we're essentially, all we can do is either increase our revenue, and we're nervous about that because we don't have fees and we're nervous about fundraising, or we can reduce our expenses to survive. And our largest expenses in the nonprofit sector tend to be our staff, which is why we focused a lot on the human resources aspect. But we still encourage you to look at doing whatever you possibly can before you start to cut staff. There are a lot of different options. There are auxiliary benefits if you're providing parking, retirement, lowering perhaps the amount that you pay for healthcare in order to keep people employed and working during this time. There are incentives to do that. There are some other creative ways to try and share the salary reduction before you have to start letting people go. Rolling furloughs are good, where you can say, all right, everybody's going to take a week off. Everybody has to do a week unpaid. But that's something that can be controlled, and it's across the organization. It's a way to immediately reduce your salary expense by 25%. Looking at a shared reduction, that's more of a furlough. We talk about it, but everybody reduces across the organization. Like, we're all now working at 50% or 60%. You can do job sharing. Again, it's going to reduce the FTE, but if you split time and have two employees working that job, it allows both employees to continue getting paid and allows them to maintain their health care benefits, which we know a tremendous amount of people are concerned about right now. Another one that is used a lot less frequently would be the level salaries, where you temporarily just set all the salaries at the same rate. But that's certainly going to require the senior leadership to make more sacrifices, which we hope our senior leaders will do that as part of their work. But you can see with the link I'm providing here, they go into a lot of detail about the creative things that you can do to try and, before you get to a stage of layoff. Some people have been expressed that they are kind of confused. They don't know the difference between these three options. Where the furlough, we're really focused on retaining our talent. We don't want to get rid of people and 2 months from now have to go out and hire 6 new people when we lost great employees. So this is when we're reducing our hours and we're all sharing a hardship, and you can maintain your benefits. A layoff is supposed to only be used, that term is really temporary separation. Okay, it shouldn't be, oh, I've been laid off, they're not replacing me. That's a reduction in force. So with the temporary layoff, there's a potential that what you can do is still allow your employees to collect, they can still collect on insurance benefits while they've been laid off. You may still be able to allow them to keep their health insurance, even if it's a form of COBRA. But then if you get to a point where you realize you can't bring them back, conditions have changed, you can transition a layoff to a reduction in force. So right now you're temporarily laid off, we intend to bring you back. If you're just saying we're going to cut these 4 positions because we can't replace, and we're not intending to replace them, that's a reduction in force. So I hope that's helpful for you in thinking about the options and the language that you're using to communicate with your teams. So essentially, when we're in times of crisis like this with HR, we encourage you to take a deep breath, and as a leader, be calm and focus on your mission. Focus on what you can control, and try and as you're working with your employees, provide them with as much reassurance as you can, be transparent. And this is a time to really think about wellness for your employees. Some people are having a very difficult time working at home. The other thing is thinking about the equity issues. Not everybody lives in a place that has broadband, and as well, reliable broadband, to put it that way. Most of us have it somewhere, but it's hard to do your job on a smartphone. In rural areas in particular, that can be a challenge. So what sort of resources do you need to provide in order to keep your employees working remotely and keep serving your clients? And essentially, when you're trying to make these decisions, we know you have to weigh the financial impact of your organization with the impact your organization is having in the community. We need our nonprofits now desperately. So, what we can do is make the best use of any of these emergent funding opportunities in order to keep as many people working and serving as many people as we can. It's just any of these changes as a manager, as you're thinking through it, I recommend that you always take a step back and ask that final question, that any of the changes we make or any adjustments we made within our organization, do they meet our state labor laws, and are they equitable? So that's it for now. I think maybe we still have a good 20 minutes for questions. I'm happy to try and answer as many of those as we can. If Nicole could maybe help filter some of those for me, I'd appreciate it.
Yeah, no, I'll feed a couple into you. We've got a couple in the chat box right now, and we've got room for folks who want to continue to remember to use that chat box to send questions in, because Angela's given us a tremendous amount of information, and but now we have a chance to be able to try and process a little bit. So we've got a good 20 minutes here if people want to begin to submit stuff. One of the first questions that came in, Angela, was in regards to restrictions around the PPL and the emergency aid, and if you could talk a little bit about that. And then a follow-up to that was, can you apply to more than one bank?
My understanding is you apply to one bank,
Okay.
and you apply to one bank for both. As far as the restrictions, I kind of feel like I need a little bit more detail around that. There's the EIDL, I mean, that's an emergency disaster loan, so you can use that for anything outside of payroll, like bills that you couldn't pay because there's a reduction of your fees, okay? You don't have revenue coming in and you have outstanding bills. That's something that the EID loan is really good for. And that grant, again, that's why that program gives the $10,000 grant immediately. You can use it for anything. The restrictions within PPP is that, as we talked about it a little bit earlier, 75% of it has to go to payroll in some fashion, but stretch that as far as you can when you're figuring that out. Include all of these additional things like the insurance, benefits, state taxes, all of anything that you can build into that payroll formula for the prior 12 months is going to help you meet the 75%. So that's all forgiven.
So and again, one quick follow. So go on ahead. Sorry.
No, I was just going to say, and remember, even within PPP, if somehow you don't hit the 75%, the worst case scenario is you end up with a 1% loan.
Right.
So that's really still a great option for us.
And how are the two linked? There was a follow-up question in regards to whether the emergency relief funds are taken out of the PPL award, or whether they're two separate things.
They are separate, but what happened immediately is about a week into it, what I learned is that emergency grant up front, because there are two separate buckets of money, think of it that way, but with the EID loan, you're getting $10,000 right away. And so what I found is that $10,000 is being deducted from whatever you're eligible for PPP. And then the loan that you get for EID, that's completely separate and can be used for other items outside of payroll. Other operating expenses, rent, just keeping our organizations operating.
So that was the question about the loan. I think we covered that one. And then let's see here. Also, there's an interesting question about sort of wellness activities or thoughts or regards in reference to you gave the nice reflection on trying to, thinking holistically about how people are, our workforce, and thinking about, so this was a question about wellness activities. thinking about things that we can do to kind of help people stay healthy in this in this time when we're cooped up a little bit. Any thoughts on that?
Oh, absolutely. I think there are a lot of really good resources online because people are now recognizing that their employees need this type of support. Ironically, it's been years ago now, probably 5 or 6 years ago, we tried to create a class around self-care for nonprofit employees because we're doing the hardest work out there. I mean, some of our organizations are, every day people are putting themselves in a really stressful environment, but we don't do anything to support them. So I'm hopeful maybe that there'll be a nice surge and we can be able to offer something like that again. Making sure that you check in with your employees. And one of the things that I've seen as a best practice is making sure that you build like 10 minutes into the meetings, into your regular staff meetings through Zoom, now that we're all meeting this way, and really have a human connection. So make sure and let people check in with one another. If you have one-on-one meetings, go ahead and ask the questions as an, as a supervisor. What do I need? What do you need? I'm sorry, what can I do to support you? That's something actually that I really appreciate from our dean at the Bush School. When he has meetings with us, he closes with, let us know what we need to provide you in order to do your jobs. And that in itself is comforting. I've seen some fun things happen, like their employees are starting to do like different walking clubs, or they'll do online yoga together, anything that we can connect electronically with wellness. And don't forget too that even for small organizations, that you could use the EAP as part of your benefits. A lot of our benefits packages have mental health hotlines, and that's something that you can make sure and highlight for your employees right now.
One more, a bit more technical question was asking about sort of different classifications of nonprofits, the 501c4 versus a C3 or a C3 or even a C19. Do you know if there are distinctions in your ability to be able to apply for the PPL?
You know what? I hope this doesn't make you dizzy. I'm going to go back to the slide real quick.
Yeah, and somebody asked for a back on the slide and I couldn't quite tell which one they were asking.
Sure. So all 501s are eligible. But for PPP, we did pull out separately that 19, C19s are eligible.
Okay. And C4s, I think that was the question in particular, but also.
I'll have to double check. I'm sure they are, but I'm thinking that might be under EIDL. Okay. I'm sorry, we'll have to follow up with you.
Yep.
More specifically, I don't want to give you an incorrect answer.
That's true, folks. You can also send an email to Angela or I or anyone on the team at the center, and we can try to field those as well to try and direct some information. There were a couple of questions about posting slides, and those will be available. And we should have mentioned that there is a recording of this. So if you want to share it with other staff members in your organization or other constituencies that you have, feel free to be able to do that as well. Let's see, Nicole, have I caught most of the questions, or folks, if I missed something, feel free to post that in.
Most of them. The one slide they wanted to see again was the grant that hasn't been publicized yet, but that you've heard about. They'd like to see some of that information again.
Oh, thanks.
Sure. So this one, again, we're going to see how this grows. It's 6 funders around the country, and they initially they've pledged collectively $7 million, but they're trying to get other foundations to join and increase this to $20 million. Here are the 2 links. They still haven't figured out the application process, as I mentioned, but I would say look at Just Fund Us. What you can do is actually register with Just Fund Us, so you will be able to get all the information and the applications as they come out. But this notion that they're looking to try and support organizations that are going to help stabilize working people, and many of us in nonprofits, that's who we're serving. They do have a, at least half their emphasis is going to be to try and help support workers and the community nonprofits that support workers. So particularly looking at first line services, healthcare, shelter, food, those sorts of things.
Right. So this is an attempt to try and address those immediate pressing concerns with folks who are losing work and losing income.
Right.
And you know what, I mean, one thing we've seen with this, right, is the vulnerable populations that we serve, just the impact of this seems to just to be hitting them harder than ever. So again, it reiterates the
Right.
importance of mission, that we were already serving these individuals, and then this kind of thing that comes along tends to hit some of the people we care about and we try to serve the most. And so, and sometimes these funding sources, right, can serve as exemplars for other funders. We don't know exactly what's going to happen in Texas. Angela and I were talking a little bit about that, thinking, how will Texas funders respond? It's not quite clear yet. We've had some neat immediate funding responses. Yeah.
Yeah, and like I said, I think now we kind of guessed immediately that we can do this much, right? Based on, particularly in Houston, we've handled a lot. If we're looking in in Texas the last few years, we've got flooding, we've got hurricanes. We can handle things. We've survived oil crisis before, but when it all comes together, it's we've got the pandemic plus the economic conditions that's creating as part of the health crisis. But then in Texas, many of us and the people that we serve are also dealing with the oil price shocks, right? And having to absorb that. So this is different in two ways, right? It's not just one issue. We're dealing with three right now. But the other thing is it's not a short-term event. And I think a lot of people are starting to realize that it's going to be a much longer recovery than we expected. There's going to be longer that we really don't know what's happening, as opposed to a hurricane that happens and now it's over, or we dealt with flooding for a couple days, now we're fine, and we can start recovering. We're not sure how many waves of this may come. So that's part of why I'm really encouraging organizations to try and start looking at third quarter this year, first quarter of 2021 as part of their recovery process.
It's tricky when you're trying to respond, but also to think long-term about how to be able to set in place plans that are going to potentially be, as you say, 9 months out,
Right.
trying to run through different scenarios that might be in play, different funding models.
And from what I've heard talking with funders, is that they really are waiting for sort of to come in as the third wave support.
Right. A long-term kind of element to them in some way.
Right. Because they feel they have the opportunity to do that. I mean, obviously this is a perfect situation for us to be thinking about at the Bush School, because government and nonprofits have a role to play in this recovery, and, in private philanthropy. So if we look at, government providing this emergency funding now, and then private philanthropy coming in as sort of that next wave, that allows us to have a longer time to recover, and it shows how we can work together.
I think it's a good thing to remind ourselves, right, that this is unprecedented in a lot of ways, and sort of the breadth, the extent of it. We're used to a hurricane in some ways, as terrible as that is. We're used to being able to think about, well, other regions of the country can send resources over to us or come down in a way and have capacity in a way that doesn't exist. There's nobody in other places that are not experiencing similar kind of things that we're experiencing. So it's an interesting phenomenon.
And absolutely, and different areas are affected differently as well. If we're in a metro area, there are benefits of having more resources than some of our rural partners and rural communities that are struggling, even more so.
I think we did pretty good. I might, folks got any other questions, feel free to send those through to the chat. Kenny, do you want to give us a little promo of some of the stuff you're thinking about talking about next week? Put you on the spot there for a second.
Yeah, just to say to everyone that's here today, thank you for being here. And same time, same place next week. Will, is the link the same?
The link is actually the same.
The link will be the same for session next Thursday at 12 noon on leadership in crisis. And basically, as you've all seen, it's a pretty trying time. We think about leadership in different ways. And the theory part is just to things that we personally need to consider, behavior that we can mirror out to folks. and to not let it confuse us during times like this as to where we need to prioritize. So basically next week's session in terms of thinking about leadership in crisis is things to remember, things not to do, things to definitely keep in mind, and just to how do we lead during times like this. And there are frameworks that have existed for a while, just exclusively in the name of leadership theory. And we'll just talk through what those things are, and same format as today, field any questions that folks may have. So look forward to having you if you can join us next week.
Thanks, everybody. This was a great session. Thank you, Angela, Dr. Seaworth. It was wonderful to be able to have you here with us, and really appreciate you putting all that information together. Tremendous resource. So as we said, these slides will be made available and mailed out to folks. We're also going to try and get them posted on our website or link them to the Facebook page. So take care, everybody. Take care of yourself, and really good to see you all online.
Thanks, everyone.
Thank you. Be well.